Good morning, guys. So yeah, today what we are gonna cover, I guess you all know. Yeah, we are going to cover AIDS. So let's study about the AIDS. The word AIDS stands for the acquired immunodeficiency syndrome. This means deficiency of the immune system acquired during the lifetime of an individual, indicating that it is not a congenital disease. Syndrome means a group of symptoms. So this is a very important word. What is actually a syndrome? Because we use this word many times, the syndrome. So what actually it means? It's a very important thing in the life of a doctor. Okay? I think you got me, right? So it's like that. Syndrome it means a group of symptoms. AIDS was first reported in the 1981. In the last 25 years or so, it is a spread over. It's not spread. It's spread. As I told in the previous video, my nose is blocked a little bit, and that's why I'm not able to speak properly. AIDS is caused. And in the last 25 years or so, it is spread all over the world, killing more than 25 million persons. AIDS is caused by the human immunodeficiency virus, a member of a group of virus called otherwise. One second, I have 12 minutes to. So I'm back again. So yes, we were talking about the AIDS. So syndrome. So syndrome. It was actually about a group of symptoms that's seen in the AIDS person. So it is caused by the human immunodeficiency virus (HIV). A member of a group of viruses called the retroviruses. So HIV is a group means HIV is member of a part of group of viruses is also known as the retroviruses, which have an envelope enclosing the RNA genome. Transmission of the HIV infection generally occurs by sexual contact with the infected person, by transfusion of the contaminated blood and blood products, by sharing infected needles, as in the case of intravenous drug abusers, and from infected mother to their child through the placenta. So when we talk about the placenta, we were thinking that okay, so it can be congenital too. It's not like that. Actually, the virus can pass into the body of the child, but it is not getting infected when it's in the mother's womb. So never the AIDS can be a congenital one, because it's the first line actually. It's acquired immunodeficiency syndrome. So AIDS is caused by the human immunodeficiency virus (HIV), a member of a group of viruses called the retroviruses, which have an envelope including the RNA genome. Transmission of the HIV infection generally occurs by sexual contact with the infected person. Transmission of the HIV infection generally occurs by sexual contact with the infected person. Transmission of HIV with sexual contact with them by transfusion of the contaminated blood and blood products, by sharing infected needles in the case of intravenous drug abusers, from infected mother to her child's placenta. The people who are at risk of getting this infection include individuals who have multiple sexual partners, drug addicts who take drugs intravenously, individuals who require repeated blood transfusions, and children born to an HIV-infected mother. Do you know when do you people need repeated blood transfusion? Find out and make a list of such conditions. It is important to know that HIV/AIDS is not spread by mere touch or physical contact. It spreads only through the body fluids. So it's not like that if you touch each person you will get AIDS. That's the most foolish thing you would ever hear of. And it can only be spread through blood fluids. It's hence imperative for the physical and psychological well-being that the HIV/AIDS infected person are not isolated from family and society. It is hence imperative for the physical and psychological well-being that the HIV/AIDS infected person are not isolated from the family and society. There are always a time lag between the infection and the appearance of the AIDS symptoms. This period may vary from few months to many years, usually 5 to 10 years. After getting into the body of the person, the virus enters into the macrophages, where RNA genome of the virus replicates to form viral DNA with the help of the enzyme reverse transcriptase. So when the retrovirus is there, it is a viral protein coat. Viral RNA virus infects the normal cell, it goes inside it. Viral cell RNA is introduced into the cell by DNA is produced with the reverse transcriptase. Viral DNA incorporates into the host genome, nucleus of their DNA. New viral RNA is produced by the infected cell. New viral RNA is produced by the infected cell. New viruses are produced and the cytoplasm is called membrane is already in circle. Segregation of the retrovirus, transmitted presentation of the lymph nodes, lymphatic and lymph nodes, and then we have the structure of antibodies, we have the heavy chain, the light chain, and then you can decide the prior topic on 2024. So the diagram from the rainbow of the area of the skin, showing the inflammation in one of the organs with the blind cases, showing the life cycle of the plasmodium. After getting in the body of the person, virus enters into the macrophages where the RNA genome of the virus replicates to form the viral RNA. So after means when the virus gets in the body, the virus actually enters not a normal cell, it enters into the macrophages. And the RNA genome of the virus replicates to form the viral DNA. Where the RNA genome of the virus replicates form virally with the help of enzyme reverse transcriptase. The swirl DNA incorporated into the host cell's DNA and directs the infected cells to produce the virus particles. The macrophages continue to produce the virus and this way acts like a HIV factory. The macrophages acts like a HIV factory because the HIV virus, when it gets into the body, it directly enters over the macrophages in the body and the virus acquire the macrophage system to replicate itself. Simultaneously, HIV enters into the helper T lymphocytes, replicates and produce the progeny viruses. So, as a human HIV and the virus enter into the T lymphocytes. It enter into the T lymphocytes. HIV enters into helper T lymphocytes, replicates and produce the progeny viruses. This is leading to a progressive decrease in the number of helper T lymphocytes. This is produced by the progeny viruses released in the blood attack other helper T lymphocytes and attack other released in the blood attack other T lymphocytes. This is reportedly leading to a progressive decrease in the number of T lymphocytes in the body of the infected person. During this period, the person suffers from the bouts of fever, diarrhea, and weight loss. Due to decreasing the number of helper T lymphocytes, the person starts suffering from infection that would have been otherwise overcome, such as those that bacteria, especially mycobacterium, viruses, fungi, and even parasites like toxoplasma. The patient becomes so immunodeficient that she is unable to protect himself against these infections. The widely used diagnostic test for AIDS is enzyme-linked immunosorbent assay. ELISA treatment of AIDS with antiretroviral drugs is only partially effective. They can only prolong the life of the patient but cannot prevent death, which is inevitable. So this is all about the AIDS. I think you have got the most of it. So let me bind this small topic in a particular summary. So what we have actually seen, so AIDS is there. So we have that the RNA comes, the retrovirus part, the retrovirus family member named HIV comes into macrophages inside the body, replicates itself, then attack the T lymphocytes, decrease its number, our immune gets deficient, so we die due to the other smaller diseases that we would have overcome if we were not suffering from AIDS, because we already had the immunity for it when we were not suffering from AIDS. But now we don't have the immunity, so we are not able to protect ourselves from those diseases like the mycobacterium or the toxoplasma, and hence we die. So this can be prevented by antiretroviral drugs, but that is inevitable, as we all know. Now, with the prevention of AIDS, so as AIDS has no cure, prevention is the best option, because it goes the line, prevention is better than cure. For us human beings, because for the doctors, they always want the patients, but AIDS is fatal, so nobody would want such bad of the patients. Moreover, HIV infection more often spreads due to the conscious behavior patterns and is not something that happens inadvertently like pneumonia or typhoid. Inadvertently, I will search for it later. Like pneumonia and typhoid, of course, infection in blood transfusion patients, new ones may be ignorant and may be rightly used, don't die of ignorance. Like pneumonia, of course, infection of blood transfusion patients, new ones from mother may take place due to poor monitoring. The only excuse may be ignorance, and it has been rightly said, don't die of ignorance. In our country, the National AIDS Control Organization, National AIDS Control Organization, and other non-governmental organizations (NGOs) are doing a lot to educate the people about AIDS. WHO has started a number of programs to prevent the spreading of HIV infection, making blood from blood banks safe from HIV, ensuring the use of only disposable needles and syringes in the public and private hospitals and clinics, free distribution of the condoms, controlling drug abuse, advocating safe sex, and promoting regular checkups for HIV in susceptible populations. Some of such steps taken now. Infection with HIV or having AIDS is something that should not be hidden, since then the infection may spread to many more people. HIV AIDS infected people need help and sympathy instead of being shunned by society. Unless society recognizes it as a problem to be dealt with in a collective manner, the chances of wider spread of the disease increase manifold. It is malady that can be only tackled by the society and medical fraternity acting together to prevent the spread of the disease. Cancer. So let's move on to cancer, because obviously we all were initially interested about AIDS, right? Weren't you? But is it cancer also so interesting? I also feel so. So let's start with cancer. Cancer. Cancer is one of the most dreaded diseases of human beings and is a major cause of death all over the globe. More than 1 million Indians suffer from the cancer, and a large of them die from it annually. The mechanisms that underlie the development of cancer or oncogenic transformation of the cells, its treatment and its control have been some of the most intense areas of research in biology and medicine. In our body, cell growth and differentiation is highly controlled and regulated. In cancer cells, there is a breakdown of the regulative mechanisms. Normal cells show a property called the contact inhibition, by virtue of which contact with others inhibits their uncontrolled growth. Cancer cells appears to have lost this property. As a result of this, cancerous cells just divide to give rise to mass of cells called the tumors. You already know about the tumors. Haven't you heard? Means tumor, brain tumor and all. But now let me tell you two types of tumors. One is the benign tumor and other is the malignant tumor. So what are these? Let's see. Tumors are of two types, benign and malignant. Benign tumors normally remain confined to their original location, do not spread to the other parts of the body and cause little damage. So benign tumors actually stay in a place. Like this is like a swelling part and just on its place, so it's a benign tumor. Not spread to the other parts of the body and cause little damage. The malignant tumors, on the other hand, are mass of proliferating cells are called the neoplastic or tumor cells. So the malignant tumors are actually the mass of proteins called neoplastic or tumor cells, and these are which the cause of cancer, because you have heard the cancer means Hindi crab, and the crab is like that. It's occupying the whole body. So it's a malignant tumor that spreads in the whole body like so transferring fast. It is called neoplastic or tumor cells. These cells grow very rapidly, invading and damaging the surrounding normal tissues. As the cells actively divide and grow, they also starve the normal cells by competing for the vital nutrients. So starve the normal cells means the normal cells they require a daily nutrient. But when this neoplastic cells, because the first there were the oncogenic cells, protein oncogenic cells, so it's like that. But due to the cells losing their contact inhibition property, it became like this. They become new plastic cells. They would divide very rapidly. They invade the cells. They take the vital nutrients of the cells. They damage the tissues near them. It's like that. So cells slaughtered from such tumors reach distant sites, store blood, and whatever they get lost in the body, they start a new tumor there. And wherever they got lost, they start new tumor there. This property called the metastasis, the most pure property of the malignant tumor. So this property of the malignant tumor is what that does not spread on, it doesn't stay on one place, and this malignant tumor follow a property called metastasis, that is through blood it spreads to the whole body and start a new tumor there, and this property is the most feared property of the malignant tumors. Causes of cancer. Transformation of the normal cells into the cancerous plastic cells may be induced by physical, chemical, or biological agents. These agents are called carcinogens. I hope that you have heard about the carcinogens biology, right? So ionizing radiations like I don't know why I use it in Hindi or this. Okay. So ionizing radiations like X-rays and gamma rays, and non-ionizing radiations like UV cause DNA damage, leading to neoplastic transformation. So some of the ionizing radiation like X-rays and gamma rays and non-ionizing like UV rays can cause a DNA damage, like there's a DNA transformation leads to the neoplastic transformation of the cells, and as I told in my voice like so much. Chemical carcinogens present in tobacco smoke may have been identified as a major cause of lung cancer. So you have heard about the lung cancer. So lung cancer, what actually causes? Because of tobacco smoking. So it's like that. It releases the carcinogens in the body that go and spread the whole body. It causes a tumor there. That causes lung cancer who used to smoke. Cancer-causing viruses called the oncogenic viruses have genes called viral oncogenes. So the viruses that cause the cancer are called oncogenic viruses and have genes called the viral oncogenes. Furthermore, several genes called cellular oncogenes or proteogenes have been identified in normal cells, which are, when activated after certain age, could lead to oncogenic transformation of the cells. So normal cells, cellular cells, oncogenes or proteogenes. Now cancer detection and the diagnosis. So early detection of the cancer is essential as it allows the disease to be treated successfully. In many cases, cancer detection is based on a biopsy and histopathological studies. So of the tissue and blood and bone marrow tests for increased tissue cell counts in the case of leukemias. Because sometimes blood cancer occurs, so in that case the blood cells number, so we need to take a count for it to know about the leukemia, which is the blood cancer. Otherwise we can just go with the biopsy or histopathological studies. In biopsy, a piece of the suspected tissue cut into thin sections is stained and examined in the microscope. Histopathological studies by pathologists. Techniques like radiography, use of X-rays, CD, computer tomography, and MRI are very useful to detect cancers of the internal organs. So MRI, CD, scan, and radiography can be used to detect about the internal organs. And computer tomography uses X-ray to generate a three-dimensional image of the internal of an object. MRI uses strong magnetic fields and non-ionizing radiations to accurately detect pathological and physiological. So MRI is far more safe, I guess, because it is non-ionizing radiation, but the computer uses X-rays to generate three-dimensional image of the internal object. Fine, whatever. Antibodies against cancer-specific antigens are also used for detection of certain cancers. Molecular biology can be used applied to detect the genes in an individual with inherited susceptibility to certain cancer. Identification of such genes is predisposed an individual to certain cancer may be very helpful. Applied to detect genes in individuals with inherited susceptibility of the certain identification of such genes is predisposed an individual to certain cancer may be very different. Prevention of cancer may be advised to avoid exposure to the particular carcinogens to which they are susceptible. Example: tobacco to smoke in case of lung cancer. So to prevent the cancer, make sure you don't get into the high power ionization and non-ionization or smoking. Got it? Now let's look at the treatment of the cancer. Common approaches for treatment of cancer are surgery, radiation therapy, and the immunotherapy. So, three things we can use when you're having cancer. Let me do a radiotherapy, immunotherapy, or surgery of you. Are you ready? Just joking, man. Radiotherapy, tumor cells are irradiated lethally, taking proper care of the normal tissue surrounding the tumor mass. Several chemotherapeutic drugs are to kill cancerous cells. Some of these specific for the particular tumors. Major drugs have side effects like hair loss, anemia, etc. Most cancers are treated by a combination of surgery, radiotherapy, and chemotherapy. Tumor cells have been shown to avoid detection and destruction by the immune system. Therefore, the patient given substances called a biological response modifiers to the alpha interferons, which activates their immune response system and helps in destroying the tumor. Biological response modifiers as in alpha interferon. So, taking proper with the okay, so this was all about the cancer. So what we saw in the cancer, it is caused with the tumors like benign tumor. Benign tumor, it spreads in the body like non-organic transformational cells called as neoplastic cells are the one which is spread so faster. And yes, it's all about the cancer. And we have a CT scan company which uses the X-rays to detect it about it. And we have MRI which is strong magnetic fields. So actually detect cancers of the internal organ. We have radiography, CD, and computer is extracted in the three-dimensional image of the internal. Three-dimensional image is treated with the X-ray, computer CT scan, and non-radiation X-ray is MRI. Monoclonal antibodies are used to detect them. Now, last but not the least topic, we have about the drugs and alcohol abuse. After puberty, adolescence, and drug alcohol use, addiction, dependence, effects of drug and alcohol, prevention and control. So this whole topic about the drugs we will cover in the next video. Thank you for following me till here. Love ya. Bye bye. See ya.